Hello, Ryan. My name is Emma. I'll be your occupational therapist today. It's nice to meet you.
Nice to meet you.
So, I understand that you were referred to me by your doctor because you're having some pain in your right wrist.
Mm-hmm. Yeah. Every time I try to do work or, anything on the computer, use the mouse or like tasks like cooking, I get some pain in my fingers.
Okay. So, what would you say that right now, just at rest, that your pain level is?
Just sitting here at rest,
Just
like
sitting
a
here.
1 or 2.
Okay,
as
good.
well.
What about when you are doing those typing or cooking, food prep tasks?
Maybe like a 4. I don't really know the scale very well, but a 4 or 5 would seem normal. Yeah, just have like, it kind of like shoots. It's like the pain in these 3 fingers. It like shoots up my arm.
Okay, I'm sorry to hear that, but I think we can do some things to help you with that.
Awesome.
So could you tell me what a typical day looks like for you?
Wow, great question. Well, with COVID and everything, it's just mainly sitting at my desk and doing work.
What kind of work do you do?
I'm a financial analyst.
Wow, that's interesting. So I would like to do some tests on you just to see if we can find out what's going on. First, can you make a fist for me with your right hand, really tight? Can you open it up? Okay. Can you go down with your wrist and back up? And now at neutral, you can put your hand on the table for this one. Can you go to try to bring your pinky out to the side and come back to neutral, and then bring your thumb out to the side? Yeah, try to keep your wrist straight for this one. Try to do it one more time. Okay. All right. So first I need to take some measurements. Is that all right with you?
Yeah.
Okay, so first I'm gonna have you put your hand right here for me so I can reach. Can you roll your sleeve up for me, please? Okay, so perfect. So we'll keep your hand and your wrist right on the table, flat at neutral. So we'll start right here. We'll do this instead. Can you bring your pinky out to that side for me? And, sorry, can you move your whole hand over to that side? Yeah, perfect, just like that. Okay, perfect. And then we'll do that same thing, but to this side for me. Yeah, thanks. Can we do that one more time, thanks?
Yep.
Okay, so just keep it in neutral, relax. And so bring, your thumb side all the way over to the side as much as you can. That's all you can do?
Yeah, that's all I can do.
Okay, do you feel any pain with that?
No, not really.
Okay, 1 second. Okay, and now, I don't really have a good edge to do it, but could you lift your wrist up for me? Yeah, so this is neutral right here.
Mm-hmm. You want me to just kind of do it right here?
Actually, that would be perfect, thank you. Okay, so I'm gonna have you just bend right from your wrist and point your fingers down towards the ground. Okay, perfect, thank you. And then back to neutral for me.
A little ahead of myself.
It's okay. It's exciting, I know.
Yeah.
And then can you point your fingers up towards the sky, moving at the wrist? Is that all?
That's all.
Okay. Okay. All right. Next, I want to test your muscles just a little bit.
Oh, yeah?
Yeah, I do. So, I'm going to test the strength of your wrist. Can you reach? So I'm going to be pushing. So can you go up just like that a little bit? So I'm going to be pushing down. Don't let me push your wrist down, okay? Ready?
Okay.
1, 2, 3. Okay, good job. That's very strong. And now I'm going to be trying to push you up. So don't let me push you up. So you're going to try to keep it at neutral, okay? Ready?
Okay.
1, 2, 3. Wow, you have strong hands, sir. That looks good. And now,
get told that often.
so we're gonna go side to side. So
Okay.
I'm gonna, do you try to stay at neutral while I'm gonna try to push you to that side, okay? Ready?
Okay.
1, 2, 3. Okay, perfect. And now I'm gonna do the other side, so try to stay at neutral. Ready? 1, 2, 3. Okay. So no problem with strength, so that's good. Next, can you flip your hand up open like that for me? So I'm just gonna test out to see if you feel anything. I'm gonna do a little nerve test right here. So is this a comfortable position for you?
Yep.
Okay. So, so I'm gonna compress your nerve right here for just like 30 seconds. Try to keep your hand flat. And let me know if you feel anything. Anything there?
It's a little tingly.
Where?
Like in my fingers.
Which ones?
These 3.
1, 2, 3?
Yeah.
Okay. Next, I'm going to do something similar. Keep it rolled up just like that. So I'm just going to do a little bit of tapping. Do you feel anything with that one? Any shooting pains?
Like, yeah, it's similar. It's like tingly and then kind of like some shooting pain. Like, it's not super severe, but
Okay. Thank you. So next we're gonna do one that looks kind of funny. So you're going to sit up straight for me and put the backs of your hands to meet each other. Yeah, just like that. So we're just gonna hold this for like 30 seconds, maybe a minute, and let me know if you start feeling anything, okay?
okay.
Okay. How's your day going?
Oh, a little weird.
A little weird.
How's your day going?
My day's going great. Thanks for asking.
Glad to hear it.
Are you feeling anything in that right hand?
Yeah, like still similar tingles and, you know, it's just uncomfortable is the best way to put it.
Okay. Any pain with that?
Yeah, there's
Yeah.
mild pain.
Okay. All right.
What doesn't kill you
So
makes
you
you
felt
stronger.
the tingling in 1, 2, 3. These ones?
Yeah, I would say like, yeah, around that.
Okay.
And
All right. And so next I'm gonna do just like a little sensory test.
that looks dangerous.
I am trained. Don't worry. Okay.
Glad to hear
So
it.
can you put your hand up for me and close your eyes and look that way so I know you're not cheating.
Jesus.
Okay. So I'm gonna see. I want you to tell me if it's 1 point or 2 points when I do this. Okay. When you feel this. Okay. I'm just gonna test your sensation a little bit.
Okay.
So let me know. Is this 1 point or
Like
2
2.
points?
Do it again.
Hold on, let me rebend this. Okay. Okay.
That was just 1. 2. 2. 2 again. I think you tried to do 1, but maybe 2 got in there.
It was 2.
2. Do it again. 2. 1. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. Tree fitty. 2, 2, 2, 2, 2, 2, 1, 2, 2, 2.
Okay. All right, thank you.
That was very difficult.
Well, it's not supposed to be difficult. Okay. So from the tests, it looks like you might be experiencing So from the test that we just did, it looks like you're having some issues along your median nerve, which could be a sign of carpal tunnel. And so I have a few things that I want to do with you to help relieve that pain, because hopefully we can prevent this, kind of turn it around, because if it keeps going the way it is, then the options could be medication or surgery, which is kind of the last resort, and we don't want that. No. So first, the most effective thing to do in the beginning of these is working on our behavior and resting more, because it seems to me that you spend a lot of time typing. Do you like to play video games at all?
Yeah.
So that's even more time on the computer, right? So we're going to need to look at your setup for your computer, see what position your wrists are in, and see what we can do to kind of take some of that pressure off of your wrist throughout your day, so it won't be affecting your productivity at work and your ability to meal prep with your family, okay? So first, I'm going to want to take just measurements so we can get a wrist splint for you. Is that okay?
Oh yeah, sure.
Okay, cool. So, can you put your hands, the tips of your fingers all the way up at the top? And
Making a turkey.
just keep your hand like neutral. It doesn't need to be spread out.
Okay.
But let me just take this really quick. Okay, so I'm gonna make points here, 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 here. Okay. Okay. Alright, cool. So I'm gonna work on getting my aide to make a splint for you while we are talking about this. But how willing are you to make lifestyle changes right now? Not huge, just like wearing a splint throughout the day, changing your position while you're typing.
I can do that.
Caution. You feel good about doing that?
Mm-hmm.
Okay, so when we get you the splint, I'm going to want you to be wearing it every night, all night, and as much as you can throughout the day, especially with typing, because I'm going to give you some techniques to help you with your positioning during typing, but if you're wearing a wrist, it's not going to, that's kind of just going to do it for you anyways, or your splint is going to do it for you. So, can I watch you actually? Let's see, I see you brought your computer with you. Can you pull it right here?
Sure.
And can you bring your seat right up to it like you would normally? Okay. So, can you pull up a document or an email for me? I just want to see how you do your typing. This isn't, no pressure.
You're gonna time me so many
I'm not gonna
words
time
per
you.
minute?
No.
I'm
Okay.
fast.
So can you type a sentence about your favorite food for me?
Let's think about this.
looks like you're writing a couple sentences.
Writing a story.
Okay.
Giving you ample opportunity to
Assess you.
analyze my
Perfect.
wrist injury and
Okay.
finger injury.
Okay. Perfect. Can I see what you wrote? Just because I'm curious. So you like breakfast burritos, especially when you're camping.
Yep.
Great. Okay, so a couple of things I noticed. We can put the computer away now. So I see that you do have a mouse with you, but one thing that can lead to agitating that nerve is using the trackpad more than the mouse. So it's good for you because it's just more.
This thing in the middle?
Yes, that's the trackpad. So we want you to be using the mouse more. And I noticed that your hands were a little bit in flexion when you were typing. So we want to work on keeping an extension. So we want to work on keeping them in a more neutral position. So if you look at my wrist, this is a safe position right here, where we have just like a tiny bit of extension. We don't want to go too far, and we don't want it to be where we're like, we have our elbows on the table and going like this either, because that will compress the nerve quite a bit. Yes. So we'll give you more tips and tricks to help with positioning for typing and work and food prep down the line. But since we are limited on time, I just wanted to give you a couple stretches to do at home that are pretty easy and quick. So the first one, I'm gonna have you make a fist, bring your elbows to your sides, and point your palms down. Keep your hands at neutral first. And you're gonna bring your palm up to the sky, knuckles to the sky, and then all the way down. And then up, and then down. Are you feeling anything in that wrist with this one?
Yeah.
Is it painful or just a little uncomfortable?
Just a little uncomfortable.
Okay. So that's just one that you can do super easy, you know, when you're getting started for the day. I want you to do 2 sets of 10 at least 3 times a day of that one. Okay. And then another one that is super easy too. Same position, wrists. Turn them in like you're driving. Now pretend you're holding a candlestick. So you're going to bring the candlestick up to your face and then down away. Yeah, up and down. So we're working on this motion right here, okay?
Yeah.
So I want the same thing with this one. 2 sets of 10, 3 times a day, or if you want to do more, that's okay too, just as long as you're not feeling pain. When you feel pain, I want you to back off and take a break from it, okay?
Okay.
All right. I think you did a great job. I think that's a lot for today. Do you have any questions for me?
Nope.
Okay, awesome. Then I'll see you next Tuesday.
Next Tuesday. Sounds good.
Okay, perfect. Thank you, Ryan. It
Nice
was nice
to
to
meet
meet
you.
you.
Yeah.